with greater resolution. And this is a great model that you want to be sure you look at because it shows the kidneys and the relationship to their drainage to the bladder. And it also, at the base of the bladder here, we have some male reproductive tract accessory glands that you have on your list also. So this is good for two things. This kills two birds with one stone. I like to always have that model on the practical. Okay, so if we're looking at the kidney in longitudinal section like this, the first thing we see are two zones, the outer cortex and the inner medulla. The inner medulla consists of typically 8 to 9 pyramids, although there's a lot of variation in kidney anatomy between individuals. They are so called pyramids because you can see this one's been dissected a little further. They're roughly conical or pyramidal in shape. And each papilla of the pyramid, or the narrow tip, rests in a funnel called the minor calyx. So here is one pyramid, and here's the papilla, and it's resting in this minor calyx. Now the minor calyces all merge together to form a major calyx, and the major calyces merge to leave the kidney at the pelvis. So the pelvis is the part of the drainage system that's external to the kidney. So it's a blue color on this tall model here, and it's numbered 13 on this model. Now once that pelvis becomes strongly vertical, it becomes more tubular and flexible, and that's when we're talking about our two ureters. And they approach the bladder at the bottom and the back. So here's our pubic symphysis for reference. There's our bony pelvis. Here's the bladder tilting forward toward the pubic crest. If I take off the top of the bladder, I can see where the ureters are approaching it at the back and the bottom. And back there I also have some other glands. The white areas here are trying to depict the ampulla, or the widened area of the vas deferens, bringing sperm from the testes. These two glands right here are called the seminal glands, or the seminal vesicles, and they contribute content to the ejaculate that's going to give those sperm some protection, some energy, and some enzymes that will allow them to be viable for as long as possible while they're seeking out the egg to fertilize it. And then here, lastly, we have the prostate gland at the very bottom of the bladder. Now, if we turn this over and look inside, we see that it's textured. Those are the rugae that we talked about before, and that we talked about in lecture today in the context of the stomach, very same. But there's a triangular region at the bottom of the bladder here that's white, and it has a different texture to it that allows the bladder to empty more smoothly via the urethra, which is the tube that is allowing the bladder to void, or that is conducting the filtrate urine from the inside of the body to the outside of the body. Now in the male, it has 3 segments. This is the first segment that you see right here, and it's moving right through the middle of the prostate. If this probe were the urethra and my hand is the prostate around it, it is completely encircling the urethra like a donut. And that section then of the urethra would be called the prostatic urethra. The next section would be called the membranous, and in our mid-sagittal sections you can see it. That is where this piece of urethra moves through the muscle of the pelvic floor. And then the section distant to that, most distal, would be the penile urethra. So prostatic, membranous, and penile. We do not have 3 segments in the female, we just have the very short urethra, and that's it. When the prostate enlarges, you can see why. It leads to difficulty voiding the bladder and ejaculatory dysfunction, because all of these glands are emptying into the prostatic urethra via the ejaculatory duct, which we could see if this was a mid-sagittal section, but we can't with the way that it's designed, this particular view. Okay, that white area called that helps the bladder to drain more easily, that's depicted in only this model, is called the trigone. The trigone. All right, so we put our bladder back together there, and we move back to the kidney. If we are looking in the cortex, we'll see a lot of these little yellow kind of bumps. Those are the Bowman's capsules of each nephron. The nephron is the functional unit of the kidney. It is the part of the kidney that does the filtering of the blood. So this capsule, as the name implies, is a connective tissue wrapping around a tiny little high pressure capillary bed called the glomerulus. So if we want to look at that blown up, you look to the far right hand side of this model. This is the Bowman's capsule. This is